So today is about reflecting on what has been achieved through the Cradle to Career programme. Cradle to Career began with that recognition that many families were navigating systems that simply weren't joined up. They were getting support too late and they were having to repeat that story multiple times.
Some of the challenges that Wirral Council were facing before Cradle to Career included a high referral rate of children for social care services, a high demand for statutory services within the area, and quite a low take-up of community support.
There was just a real lack of a team approach, I guess, across different sectors and different parts of the world.
Our numbers for family support and any support we were offering to families had gone right down, and I didn't understand, I hadn't realised that was the case until Cradle to Career came into the area and started mapping and talking about what they were going to do.
Because we were assessing families, you were so busy it was taking up to 40 days. The time you recognised the support that was needed and got that support in, often the family would say, "Oh, I don't need it now," and they'd withdraw from engaging with you. Or the situation had escalated, so you were going beyond the support you'd initially identified.
This hasn't been just one single project, it's been a structured journey that has required everyone to work together and collaborate.
What influenced our decision to join Cradle to Career was it was very much aligned to our values, supporting families and young people for the long term, achieving their potential and actually making sure that they were given the best start in life. But also recognising that actually we can do so much for young people, but we're only a small part of that system and that ecosystem. So joining with other like-minded partners, we knew that we could achieve a lot more together.
Both my parents were social workers for the Wirral. When I would talk to them about, "Oh, this happened at work," or "We're trying this," they would often go, "Oh yeah, we tried that. Oh yeah, we did that." So things needed to be done differently. I thought I liked the idea of working with other professionals, thinking more preventatively, and that spoke to me.
Better literacy outcomes for our customers and their children, who are likely to be our customers in the future, mean that those people will have better life opportunities. If they have better life opportunities, they're much more likely to be able to contribute to their neighbourhoods, to sustain their housing tenancies. In simple terms, there will probably be more money about in those neighbourhoods, which will make those neighbourhoods more attractive places to be. So for us as the landlord, having attractive neighbourhoods and having places where people want to live and are long-term sustainable, well, they align exactly with our aims and our objectives as an organisation.
What influenced us to join Cradle to Career is the partnership that started developing with other community organisations and charities on the Wirral. We were developing a relationship with Koala North West, and then we're brought in with Equilibrium. So actually that support of working with larger, more established charities to really try and focus on what we were trying to do and provide the service we were was really encouraging to us, and trying to expand that offer with the different things that we all do to really bring that wraparound support to the families.
The impact of the Cradle to Career team on the community, I think they really engage well with services. I think the engagement levels have increased, but at a lower earlier help perspective, so engaging more with the community offer, with the voluntary sector offer, and not necessarily needing that more intense statutory intervention work.
The differences we saw between sort of working with Cradle to Career was that multi-agency approach. Youth services can often be the forgotten partner, just seen as we do things with young people and diversionary activities, but we're so much more. It was a chance to showcase that support through the multidisciplinary teams, so we were able to join the dots really with professionals, showcase what we were doing, but also then make sure that the families that we were working with were getting the right support.
What this project's allowed me to do is when a referral comes in, we share it as multi-agency. So as a team, we look at what is the need. Then workers then react straight away. So even if the assessment's getting done, It's getting done alongside the support that's in that home. By the time the assessment's finished, a lot of the work's been done, and it hasn't escalated because we've put them preventative measures in. So it allows social workers or social care to step back again, which is what you want.
It was just bringing us together as community organisations, as schools, as the MDT, working with social workers, family workers, that actually allowed that earlier intervention to come into place where families could access us from different avenues rather than just waiting to hear from us or seeing something on social media or hearing about us from word of mouth. It was actually more of a referral pathway that was being created, which really supported the access to us.
We've done a transition project. It started out as work that we wanted to do for year 6 going into year 7, but what we noticed was actually that every transition was really challenging for our pupils, so going from year 2 into year 3, key stage 1 to key stage 2. So what we developed with Cradle to Career was a real mental health focused approach to what we were doing, and we've collected all that data, kind of looked at what was going on with that data, put a really robust programme in place which was funded by Cradle to Career, and then we rolled that out with parents as well. So that's had a really massive impact on the mental health and wellbeing of our pupils. It's meant we could go on and get an award in the mental health work that we're doing. But without Cradle to Career, we wouldn't have been able to do any of that.
One of the things that happened back in 2023 was the opportunity where Cradle to Career put a funding opportunity out around a SEND collaboration. What that enabled Koala North West to do was to appoint our very first dedicated SEND practitioner for North Birkenhead. The other 2 partners were, so Equilibrium were doing preschool groups for children with SEND, and Web were doing a sunshine group, so that was for women whose children were SEND. So we were offering something very different, and we were 3 organisations that knew each other but hadn't worked together in that close way before. So that was really positive.
We have lived experience, level 5 coaching trained peer support workers that can sit with a family and actually engage them and understand with them and empathise to understand what's going on, where they're at, and share their lived experience. Now, no one story is the same, but actually just that empathy is really, really supportive. One of the biggest things that we do see is the turnaround in their wellbeing and their mental health, and then their desire to volunteer to support other parent carers. That's one of our biggest wins that we've ever had.
I can think of numerous families, one that came to us quite early on with 3 young people and a mum. It was at the point of going to court. It had really escalated to a significant level of concern. That family stayed with us, with me, for about 2.5 years. The whole team was effectively involved, from family support workers, school readiness workers, the full range. For all of my colleagues will have supported that family at some point, and we began to sort of see change. But I know that family now continues to work with one of my colleagues, a family connector, and is sort of talking regularly with them, and I get feedback, and that's really nice to hear that a family that I was working with previously is doing well. I know that family has been able to travel abroad, has reconnected with long lost family members, and again I get that feedback, and I get really quite some pride or pleasure in knowing that their story has continued in a positive way.
Over the course of this programme, we've been through 3 phases together: discovery, delivery, and now looking ahead towards resilient communities.
I think what's essential now as we move forward into the next phase of resilient communities is that the community really do have ownership of the next part of the programme. I know that something Right to Succeed are trying to engage with at the moment is the members of the community being on the steering group.
We've got a strong steering group, so that's something that we really want to build on.
I think for the community of North Birkenhead to take on the sort of mantle, really, it's to make sure that they know that just because the funding's finished, we're not all abandoning that community. I think the trust that we've developed, the relationships, the ways of working, we've all got a responsibility to continue that, but involve the community in those decisions going forward too, including, of course, young people.
We're rooted in that neighbourhood, so it's absolutely in our interest that we build on the foundations and the momentum that's been achieved through Cradle to Career to make sure that that carries on into the future and becomes business as usual, but also that we continue to realise the opportunities that have happened recently into the medium term, into the long term and onwards.
When we started in North Birkenhead, they didn't trust professionals, they didn't like you, they had a view of what you were there for. All that's gone. And I don't personally think it'll come back because we've established that relationship now. So I think because they trust us, they know how we work. And even when Right to Succeed move on, we're not moving on, we're the team. And we built them relationships. We're sustained in that community. They know us. We're not suddenly going to change who we are, how we work. So as long as we're there, we'll keep doing what we've been doing.